initial video consultation. So I'm Dr. Glazebrook, but you can call me Jane. And during your initial consultation with the Slimming Clinic, it is roughly 40 to 50 minutes. And we do a full medical assessment with you, including a live weigh-in and a live blood pressure reading. And we have done your formal ID checks. I have already seen your passport. We also review that pre-consultation questionnaire that you kindly completed so that we can discuss the diet and lifestyle changes that might be appropriate for you in order for you to get to the weight that you're looking to achieve. And then we can discuss the various prescription medications that might be suitable for you in order to help you achieve your weight loss. And then I will pass you through to one of our clinician support team who will get you started on a program. Does that sound like what you were expecting from today?
Yeah.
Excellent, brilliant. So
I guess it's since my kind of early teenage years. I did a lot of sport when I was younger, and then I kind of stopped because, you know, exams and bits and pieces as you get into your later teens and going to university particularly. Going through puberty really kind of hit me quite hard, and ever since it's just been a yo-yo of up and down, reaching certain points, doing really well, and then piling it all back on.
Currently, is it sort of snacking, portions, the type of food for you?
I would say it's a healthy mixture of snacking and portion size. My biggest issue is it's that sort of 11 o'clock and 3 o'clock that, you know, when you're
Hannah. So we do quite a thorough medical assessment. That's for a couple of reasons. Obviously, we want to assess if your weight is starting to impact on your health, if you have any comorbidities, and if you have any contraindications to any of our prescription medications, so that we can safely treat you with medication if that is going to be part of your program. So have you got any ongoing health issues that you maybe see your GP for or struggle with? And blood pressure reading together. So do you know how tall you are?
Yeah, I'm about 5'1".
Okay. Right. And in terms of weighing yourself, have you got your scales to hand? So
Yeah.
essentially it is what it says on the tin. So pop yourself on the scales, take me with you and show me what the scales.
Yeah, I think I kind of, I don't know, for some reason 10 stone in my head is what I would think.
Okay, fine. And body mass index, which essentially takes your height and your weight, and it comes up with a figure that then categorizes you according to patient data, and it's health data. So we know in certain categories you're more at risk of developing weight-related ailments, primarily obviously the overweight and obese categories. So our aim is to try and get you as close to or within a healthy BMI as possible, so that you're at less risk of developing those weight-related ailments. So currently your BMI is 30.3. Now anything over 30 is considered obese. Anything over between. When we lose a lot of weight really quickly, we actually lose a combination of muscle, water, and fat. And when we lose muscle, our metabolism reduces, and it's a lot easier to regain weight. So that's why classically you can sort of see those sort of yo-yo dieting patterns emerge. So we want to avoid that. So that's why we aim for about 1.5 pounds, 2 pound loss per week, because you're more likely to be targeting fat loss. So in order to get down to a healthy BMI for you at that trajectory, we're probably looking at about 3 to 4 months to achieve that. For 10 stone. For you, I think the main changes that we're looking at are, you've been able to highlight them yourself really, cutting down the snacking in between meals and watching the portions. So you don't have any direct contraindications to any of our medications. Was there any particular, have you done sort of your research? Have you had a look into what medications we can prescribe for you?
Yeah, so I read up on your website about the options.
And you're finding that it's the sort of constant need for food and sort of snacking and sort of portions, and appetite suppressant will probably be my recommendation for you. As I said, you don't have any contraindications to either of those appetite suppressant treatments. The main sort of difference can increase your blood pressure and your heart rate. So we always do a baseline blood pressure reading with you first before starting you on that medication. Now, it is rarer, as I said, but it's something that we still monitor every patient that's on that sort of treatment. We are more concerned with patients that have higher blood pressure readings or have unmanaged high blood pressure. So if you don't mind, we'll do a blood pressure reading together now. So you have got your auto that you think might be more suitable for you.
Yeah, I think from what you've told me, and just on the fact that maybe my blood pressure readings are a little bit high, maybe Saxenda is a place to start.
Yeah.
And then if I lose weight and my blood pressure comes down, we can perhaps, you know, talk about the tablets again. But I think Saxenda seems like maybe my safest bet to start off with, really.
Yeah, well, that's definitely a sensible option. I think that's a good option. And as you know, you say you've got that flexibility that if you at any point you do want to switch or change medication, we can go that way. Okay, so in terms of the medication, that's the prescription medication, we also do have a lot of additional support. So our additional in order to authorize any treatment that you take today, Hannah, would be your consent. So we'll send you a consent form. It's an electronic form. It gives you the option of whether you would like your GP to be informed of your treatment with us. Obviously, we do recommend that. But if you'd rather your GP not be informed of your treatment with us, just keep us fully up to date with any health issues, any changes to your health, any medications you're prescribed elsewhere, so that we can make sure that we're always prescribing safely to you. So that will be sent to you via email. Don'ts with the medication. So we already talked about pregnancy prevention and why we ask about periods, but we also do say to avoid alcohol while on our medication. So it doesn't sound like alcohol is necessarily something that's contributing to your weight, because it generally sounds like it's not excessive and it's only in the weekends, but with the medication, we do say to avoid it while you're on treatment. So if it was a special occasion, we have got Christmas. Thanks for joining us, Amy. So Hannah, Amy's from our clinician support team. She'll go through the programs with you relevant to what we've discussed today. She'll also arrange a follow-up appointment for you and send you that consent form that we talked about. So Amy, Hannah's a completely new patient with us. She struggled with her weight for the last 15 years. Her main downfalls tend to be portion control and snacking in between meals. So we're looking at about 3 months to get to Hannah's personal goal, and it's about 4 months to achieve a healthy BMI for Hannah. Hannah, was there any questions that you had for me before I leave you in Amy's capable hands?
No, thank you very much, Dr. Jane.
No problem. I wish you the best of luck and welcome to the Slimming Clinic. Take care. Have a good day.
You too.
Hi, Hannah. So it's just us on the call now, and I'll just finalise the last little bits and get your programme set up for you. So I hope the consultation went well and you enjoyed getting to know Dr. Jane. So what the doctors advised is that you've got 3 months to get to your initial goal and 4 months to get to healthy BMI. You have a deposit on your account as you booked with us, so that will come off the cost of your treatment today. You can spend that with us today. So what the doctors advised is that you're going to go ahead with Saxenda, which is our injectable medication. That chromium is part of your prescription for those sweet cravings. That lean shake would be really good for a meal replacement for you, and also xenobiotics. So we can. What do you feel would work best for you?
So I think maybe the pay later, the finance option, because can you spread it over like a number of months? It doesn't have to just be over sort of 3 months that I'm losing weight for.
Absolutely, yeah. You can personalize it to work best. So I'd love to tell you a little bit about the delivery so you know what to expect. So it is a tracked and signed for delivery. Royal Mail is our courier, so they'll be sending you the tracking updates. The program will start from when we take payment, which is the 23rd of November, and you're going to have enough medication now to last you for the next 3. While you're on the phone with me, I am going to book in your 2-week follow-up as well. What we'll do is we'll take payment for your plan, and then we'll book that in at the end. And we'll also talk through your consent form as well.
Okay.
So what I'm going to do, Hannah, unless you had any other questions, I'm going to hit pause on the recording now and we'll go ahead with payment.